Hi everyone, welcome to pharmacological and non-pharmacological treatment of FMP3, already brief. This case involves a 41-year-old woman with a history of asthma who was admitted with 2 days of fever and symptoms of nasopharyngitis and weakness. Using rapid influenza diagnostic techniques, influenza A was confirmed. A comprehensive treatment plan consisting of both pharmacological and non-pharmacological interventions is necessary for the maximum improvement of the patient and prevention of complications. Oseltamivir, commonly known as Tamiflu, should be initiated promptly. It is a neuraminidase inhibitor that prevents the replication of the virus, subsequently reducing the duration and severity of the symptoms of influenza. Clinical guidelines recommend initiating antiviral therapy as soon as possible after symptom onset, preferably within 48 hours, especially in patients with underlying chronic respiratory disease such as asthma, wherein early antiviral treatment prevents exacerbation and other complications. Acetaminophen is preferred over non-steroid anti-inflammatory drugs NSAID to treat fever and malaria because of its safe profile in asthmatic patients. NSAIDs may aggravate asthma, while acetaminophen serves to reduce fever and relieve aches without the impairment of respiratory function. An increased frequency of budesonide, a type of inhaled corticosteroid, is used to control airway inflammation during the acute phase of the viral infection. This adjustment aims to avoid asthma exacerbation that the influenza virus may trigger. The administration of albuterol should be continued immediately as needed to provide relief for any bronchospasm, ensuring that the airway remains open, providing comfort for the patient as she recovers. Promoting hydration and rest helps strengthen the immune system in fighting the disease and enables the healing process. Adequate intake of fluid helps in maintaining mucosal hydration. Resting on the other hand, preserve the energy needed by immune system to fight off infections. Using humidified air therapy offers nasal part moisturizing effects against congestions. The peaceful feeling they somehow minimize discomfort and improve breathing. Using a personal humidifier could really settle upper respiratory symptoms induced with influenza. Reinforcing the patient's asthma action plan is key. Patient education can allow her enough capacity to self-manage during influenza illness. She should be educated to recognize early signs of asthma exacerbation and understanding fully when she ought to seek medical advice. Advising on isolation precaution measures during any infection to avoid transmission of the influenza virus to other household members and the community should be in place. The patient must remain isolated until 24 hours after the last fever is recorded without the use of antipyretics. A new pharmacological intervention of prescribing oseltamivir has never been rendered during my practical experience. Informing the patient that he or she must finish the entire regimen and discussing the adverse reaction of the medication such as nausea and vomiting promotes informed consent and patient compliance. Humidified air therapy is recommended here as a new non-pharmacological approach for symptom relief. Discussing the benefit of using humidifier and providing information regarding proper maintenance and use will greatly enhance the comfort level and satisfaction of the patient. In conclusion, integrating evidence-based pharmacological intervention with supportive non-pharmacological measures offers a balanced method of care for influenza, especially in patients with underlying chronic conditions. This so patient care intends to relieve symptoms, minimize complication and hasten recovery, with the focus primarily on the patient. Thank you once again for listening.